Dr. Aditi Govitrikar, it's a pleasure to have you here.
Thank you so much.
Actor as well as wellness expert. Completely diverse fields, yet interlinked. But to begin with, as a psychologist, I'm sure you understand how important mental health is. But that's something that a lot of people in the country, especially in the rural areas, still struggle to cope with. How do you think we can improve its awareness across the country?
Thank you, Nihal, for the question and for having me here on this conversation. Basically, I think one needs to understand that it is not only rural India, but even urban cities in India are hesitant in accepting or getting treated for any mental disorder. We still have that taboo factor, which is like, अरे पागल नहीं हो या ये सब क्या है, ये तो बनावटी बातें हैं. This kind of conversation still happens in many homes where there are people who suffer from mental disorder or mental illness. So we need to understand that just like your body falls sick or it is attacked by a virus or a pathogen or a bacteria, similarly your mind or your mental condition, mental state can be unwell. Your mind can be fractured. So if that is happening, if your bone gets fractured, you go to an ortho, you wear a plaster and you get okay. Similarly, if there is a fracture, there is a crack in your mind, go and get treated because these illnesses can be managed. But if you don't manage them, then they can worsen, and that can be very difficult not only for the individual but for the family as well. So where rural mental health, that's completely over there, so it's completely unheard of because there they'll take that broom and they'll do all the, they think it's some kind of a bhoot pishach and all
Black
these
magic.
things, black magic.
Yeah.
So I think one of the ways of bringing awareness to rural areas of India is of course media, because today everybody has a smartphone, everybody has access to a small screen, and if people like you guys talk about mental disorders, mental health and spread awareness, that will be one step of doing so. The other way of course is if we have psychologists and psychiatrists going to rural areas, maybe for a few months or maybe depending on how much time they have, if they can go there and talk to people there and understand where, because there are a lot of superstitions which are linked to mental disorders. So if we can demystify that will also definitely help.
Thank you for that. While doctors, of course, help their patients cope with mental health issues, we do not discuss about doctors' own mental health.
Yes.
Especially during COVID, while people were trapped in their homes and they faced several mental health issues, those doctors who were in the hospitals, seeing people die day in, day out, their mental health was severely impacted as well.
Yes.
Do you think that's something that we need to speak a little more about?
Definitely, because there's a lot of burnout that doctors face because it is a profession where it is taxing mentally as well as physically. So it is one of those professions and the timings are not fixed. The doctor doesn't eat food on time. Plus nowadays the pressure of assault or that is an additional thing that the doctor has to face. So that fear is always there, and the levels of anxiety. If you, God forbid, you lose a patient, maybe because it is a natural way or because of the illness or whatever, but the doctor always gets blamed, and that is of course glorified then by media, unfortunately. So these kind of things play a big role in a doctor's mental health status. So what is important to understand here is that a doctor is a human being too, and please don't push yourself to the level of burnout. Be careful. Take care of yourself because self-care becomes very, very crucial. The minute you take out some time for yourself, develop a hobby, meditate, or just sit and look outside, you will feel a lot better. It will take care of your mental state. You will be a lot more relaxed. You will be a lot more calm throughout your day. So for doctors, please take care of yourselves.
You made a very pertinent point earlier on the discussion when you said that for a body, when it's fractured, you go and see a doctor. If our mind is fractured, we should do the same. So when our body faces some problems, we eat medicines. That brings me to probably a bigger taboo than mental health, which is antidepressants. So when our mind is injured, should we also resort to having medicines? Yes or no? If yes, then how do we go about it?
Right. So when we talk about medicines for mental disorders, it's not only antidepressants. There are various. So depression is just one of the mental disorders. There are many other disorders. You have schizophrenia, you have anxiety, you have panic attacks. There is body dysmorphia. So there are multiple personality disorders. So similarly, there are many disorders, and there are different medications for all. Now, all the illnesses don't have medications. There are some which need us psychologists to help with therapy. So there is talk therapy also, which plays a role. There is art therapy. There is drama, which helps some cases. So it depends on what the requirement is. Now, where depression per se, because you mentioned antidepressants, if let the psychiatrist decide if the patient needs or the client needs medication. Because if it's a clinical depression, then surely that person might need depressants. But if it is not, then talk therapy can also. So it depends. It's very case-wise kind of a decision that a person needs to.
Sure. Therapy is of course very important, and I firmly believe that all of us need it in one way or the other.
Yeah.
However, one problem there is that therapy is something that's still considered to be for the rich. Or probably, so to say, upper middle class, because of the cost, right? 1 hour of therapy would cost you, on an average, with a good therapist, about $1,000 or about 1,200 rupees, right?
Yeah.
How can we make therapy affordable? Especially because, like you said, this is not something which is limited to urban areas.
Yeah.
The 140 crore of us, everybody has one or the other issue.
Yeah.
So how can we ensure last mile delivery of, mental therapy?
Now tell me, Nihal, when you go to a coffee shop, 2 people, what is your bill? If you have to pay 1,000 rupees for your mind that is fractured, for somebody who is a professional, that person's time, and you heal from that, is 1,000 rupees too much? And I'm talking about urban India.
Sure.
I'm not talking about rural India. You go in an Uber today from place A to place B. What is the cost? So you go for a film, how much do you spend? So if we can spend on, say, any marketplace, Amazon or wherever, we swipe and we quickly buy without thinking. But to pay that 1,000 rupees for 1 hour, that's 60 minutes of somebody's time, is it really too much? That's my question. Now, where rural India is concerned, that's a completely different ballgame, because I understand that it depends on your financial status. And not all psychologists charge 1,000. There are different levels. There is also free service that many organizations provide. It is about you wanting to get better. That is a crucial thing. Money is secondary at the end of the day, in the sense that there are people who also offer free services.
Sure. To conclude, I'll just probably go with the fact that private hospitals, private psychologists are doing a lot of work in mental health. Do you think the government needs to do a little bit more to ensure, to create awareness and to bring about more programs in this particular area?
Definitely. I think along with the government, however, I would also say all of us, every single individual needs to take charge of the fact that depression is on a rise. Anxiety, panic attacks have become a commonplace. So let's not get into this, ho jayega, chalega, chal chai peete, chal film dekh lete hai, because it's not that simple. We have to learn to become aware and acknowledge what is actually happening with the person. Because we all know that one friend who has committed suicide, or you hear of somebody and you're like, "Arey, but that person seems so normal or so happy," so to say. But one doesn't know. So if somebody is showing signs around you, please help that person and don't say, "Chal kuch nahi hai, ye chal chai peete," kind of a conversation. So that's very important.
Sure. So I really hope we're able to move away from that one distraction to actually addressing the issue and trying to resolve it. Thank you, Dr. Govitrikar. Absolute pleasure speaking with you.
Thank you so much for having me, Nihal.
Thank you.